Good afternoon, everyone. Good morning to those of you west of the East Coast. We are really glad to welcome you all back today to the Build Home-Based Childcare webinar series. And today we're going to be discussing supporting home-based childcare educators whose primary language is other than English. My name is Danielle Fuentes Johnson, and myself, along with Gina Capito, co-lead the home-based childcare work at Build and will be your facilitators for today's call. We're very excited for today's call, as we know that this is an interest area and an area of need as we support the work for home-based childcare. While we're getting started, if you can go ahead and put your name and where you're calling from in the chat, that would be great. We get to know each other and see some old friends and meet some new ones. And we're going to go ahead and launch a quick poll that gives us a little snapshot of who's here today and what your role is in early childhood. We also will say that as always, this will be recorded or is being recorded, and this, along with the PowerPoint, will be shared out a couple of days after the event.
If you don't have access to polling on your platform, I'm about to just quick and share the slides so that you're able to see the question for the poll, and go ahead and put that in the chat.
So as we get started today, we're going to welcome everyone back. Gina's going to give us an overview and a reminder of Build's guiding principles for home-based childcare in our work. Then we're going to learn more about LUNA and Hmong Early Childhood Coalition. And then we'll talk about next steps and what comes next. We'll go ahead and end the poll and share it out, and I'll turn it over to Gina.
Thanks, Danielle. Welcome, everyone. We are really excited to be launching into discussion really much more intentionally and deeply around the idea of supporting home-based providers whose first language or they are bilingual is other than English. And we know that this is a content that we've covered in multiple ways over the course of all of our home-based childcare provider activities, but we really are launching into a series that's going to continue into the early new year. And we want to hear from you on what you want to learn in here and what areas you're working on. So we want to hear your successes in this area as well as your challenges. So don't hesitate to be sharing things in the chat as we continue on in this way. And with looking at the results of the poll, we've got a large percentage of folks, 62% of folks that were able to complete the poll are in a support organization role, coaching, training, technical assistance. So I would imagine that you've got lots of examples of challenges in trying to work with providers in multiple languages, as well as the successes and strategies that you've developed. So we'd love to be mining that in order to support others in your position to do that work. And then the next highest group that's joining us are system administrators. So folks that work in the intersection of different systems, as well as probably folks that are supporting the administration of public funding to family childcare and home-based childcare settings as well. So thanks for taking a moment and checking in on who we have with us. It'll also really support our speakers in thinking about how they tailor their content to you as well. So I'm going to move us forward, as Danielle mentioned, to talk quickly about the core beliefs. We always touch base on these beliefs at the outset of every webinar, just as a reminder of what's guiding us. We are really thinking systemically about the engagement of family childcare, family friend and neighbor care settings, and we put those all under the umbrella of home-based childcare. And so we move in and out of the terms family childcare and home-based childcare, but we are not making a determination within that of only one type of provider who offers care to young children in their home. We're really inclusive of all the different settings. And for today's work in particular, as we really think about how we are being responsive to the needs of those providers and meeting them where they are, really what jumped out at me was core beliefs 1 and 3. So that how important it is that we acknowledge and are working on the reality of a world where our family childcare and family friend and neighbor care settings are part of the fabric of the early care and education system in your states and communities. And then 3, that the strategies working with those providers is responsive to their needs and intentional in how it was developed. And so I know that both of the speakers are going to speak to this idea that it's not about taking center-based services or support and just saying, oh, I can do them over in a family childcare setting or a home-based provider setting, but that we're really from the ground up developing things that are unique to this type of care modality. So those 2 core beliefs in particular really jumped out at me. One other thing that we want to be highlighting, because there's been much movement, and we've talked before about the unprecedented investment in childcare that we are seeing right now from the federal level. And so we always want to be highlighting and kind of holding this in our minds as well as we really think about how do we achieve that first core belief of having family, friend, and neighbor and family childcare settings as part of the fabric of early care and education. We need to be really thinking about how we are maximizing federal investments, informing the state decision-making around those investments, and really ensuring that what is being built and how those dollars are being leveraged is inclusive of this care modality and really uniquely targeted and supporting and built for this particular care modality. So I just wanted to, just a reminder about the opportunity that's in front of us related to the federal investments and how we're working to respond to those as states and leaders across the country. So just a couple of things before we then move into hearing more from Pilar. One of the first things that we wanted to hear from you as a second quick poll is to learn a little bit more around what it is that you're able to do as an organization in languages other than English. So we often ask just whether or not supports are available in a language other than English, but we also know that there's a tremendous continuum of what that means, that translating a handout into more than one language is very different than having deep coaching available in individuals' home languages. And so we want to hear from you with this poll that gives us a little bit more detail on where you are in this work and what that looks like in your states and communities. And again, if you're not able to use the poll function itself, just taking a look at these bulleted lists, don't hesitate to answer in the chat which of these things you're able to do in languages other than English within your organization. And certainly if there's things, this is not an exhaustive list. So if there's anything else that you are doing in multiple languages, then don't hesitate to share those ideas in the chat too. So the forerunner right now in the results does continue to be the translated documents, but we do see that not far behind, we have bilingual staff, non-native speakers, and actually higher percentage of staff who are native speakers in other languages as the two next areas. It's slowing down a little bit, so close to share the results. Telephone interpreters then sort of came in next, and then recruiting from the community, which I think is such a great strategy as well when we really think about not just having things translated or having an individual maybe that's not of the community, but it can speak the language, but actually engage with the community then to get more of that voice and guidance. Don't hesitate to continue sharing more on these concepts. And again, some of your thoughts on successes and strategies to achieve some of these things within your communities and states. We want to be capturing up some of this and really think about ways to put it back forward to you as a field to help you, to support you in these efforts. So with that, I'm going to now introduce Pilar Torres and turn it over to Pilar to take us into talking more about Luna. Pilar?
Hi, everyone. Thank you so much for this wonderful opportunity to speak to you all. Very happy to talk to you about Luna, a very huge passion of mine. So I have a lot of slides, so I'm going to kind of skim through some of them because I know you guys have a lot of this information. So Luna was created in 2020, right before the pandemic, but we leverage about 20 years of experience working with this population of providers. And our objective is to be a comprehensive resource for like the continuum of from FFN to licensed family childcare providers. And we love to say that we're unapologetically supportive of Latina providers. Our flagship model is called Escaleras, which means ladders in Spanish. And we created Escaleras because we know that there are in many locations in the United States and many communities, there are a lot of barriers to licensing and support. Often there are not enough services in Spanish, or they don't go beyond, maybe translating brochures or having one or staff person. Unfortunately, we also have learned, and we know from a lot of qualitative data, that there are many unwelcoming systems for these women. And if there are services, they tend to be very disjointed. And so there doesn't seem to be like a coordinated pathway for that. So our idea is that Escaleras is like that little ladder that can support Latinas into the mainstream system. And so we want to build that coordinated, welcoming, linguistically and culturally responsive pathway. I'm sure you guys know a lot about this data, and we know that Latinas among the foreign-born and non-English speaking workforce is by far the majority in most locations in the United States. So they are about 19% of the overall workforce, about 25% of the home-based workforce, and they're becoming almost the majority in many parts of the country. So California, they're already the majority. Florida, they're growing very fast. Illinois, just to give you some examples, has grown by 305%. And as I said, most of these are Latinas. We know that there are hundreds of thousands of unaccounted providers who are now, I think the light was shined on them during COVID-19 when we realized that these are women who are providing key childcare services to workers in essential sectors of our economy. We know that many of these women are completely unsupported. They're underground, they're unlicensed, they don't receive any services whatsoever. And yet we know they play a vital role for many, many communities who depend on them. And they face a lot of challenges and a lot of issues. And really, they are essentially subsidizing the childcare, the workforce of, they are, carrying a heavy, very heavy load. And they are serving the majority of the most vulnerable children in our nation. So Luna decided that we wanted to find a way to scale the work that we had done for many years in Maryland, and we wanted to leverage technology with the understanding that technology is an equity issue, and that, like language access, digital literacy is like the next equity area that we really need to look at. Nonetheless, Latinas are more connected than ever to technology. Most of them have a mobile device that they are used, and they have some knowledge and some apps that are very ubiquitous for them. So Facebook, WhatsApp, even Instagram. So we wanted to leverage this knowledge that they already have and find ways to be responsive, to connect them in an efficient way, and in such a way offering them better access to resources. So we created a series of 7 modules that are, color coordinated, as you can see here. These colors actually match California's childcare early childhood competencies. They are aligned with CDA competencies and the NAFCC competencies. So it basically takes these women through a ladder of professional development, starting with early childhood and ending with professional ethics and networks. And the training is delivered semi-virtual, facilitated. It was originally designed to be hybrid. Now, because of virtuality kind of accelerating, it's designed to be a facilitated virtual experience. So they are consistently receiving support as they go through the process. Next. There is an avatar that we call it Teresita that accompanies them. The training is state approved, and that's part of the process that we would do with you if you were to pick this program up. We've been very intentional about the user experience and the user interface, and we understand that for many of them, they still want to be able to download and have either printable materials or reading things off their phone. So every single module has a manual as well as interactive activities that they do as a cohort. Our intention in Luna is to power your outcomes. So we want to support whatever's happening in your community, and we don't want to replace anything that already happens. So in many ways, we want to find out what's missing and help you fill that gap. We know that this model can really support your community in building essential childcare supply, not only in underserved, I don't like the term childcare deserts, because I think it really, it's kind of a statement that really doesn't capture what's actually happening in these communities. But we know that these providers are a hot commodity, and once they are able to become licensed and more formal, many communities seek their services, not just Latinos. We know that the CCDBG, ARPA, and the infrastructure bills, all of these include language on building childcare supply in underserved communities. Unfortunately, we also have evidence that many states are really not doing a lot of intentional work around this, and they're focusing more on stabilization. So we really want to encourage you, and we want to support you Often when there's some research that shows that many state leaders are not doing enough because they don't feel they have the capacity, and we want to support you with that. So obviously these modules focus very thoughtfully and intentionally on CCDBG health and safety, topics that are mandatory, but we're also very intentional about child development and really engaging them through this idea of becoming brain architects, and very, kind of emotionally engaging them into this profession. So Luna's goal is to support you. We are your support system. We help you train a local partner. We don't deliver this training directly. We work hand in hand with your local partner. We organize and support you through the entire recruitment process. We offer the whole Escaleras process that can go between 6 to 8 weeks, even 10 weeks, depending on how you organize the process. And then we do like the final push to really coach them through licensing, which is like really important. This model is also very intentionally designed to support cultural competence for your community, your staff, your team. It supports collaborative leadership and developing partnerships, and this is really developed in a collaborative way with a lot of people sitting at the table. We do leadership development also very intentionally for the providers. And at the end of the process, one of the things that we like to measure is what happened in terms of like a retro feedback, so that your system responds and changes in terms of policy and practice that needs to be adjusted to really support these providers. And there's a lot happening with that. And we would like to help you with that. So the way that the program is implemented in a nutshell is that it's a 3-year process. We begin by recruiting a cohort in year 1. This is kind of the way we deliver the training. That red block is the part that the organization is the most involved with, our local partner, because these are your local regs. These are your local, health exams and making sure they get the fire inspections and all that. We open up a Luna community for that location, and then the providers receive badges as they continue going through the process. And that kind of community of practice meets continuously through the whole 3 years, no matter, and everybody's welcome into that space. It doesn't matter whether they're FFN, if they want to be licensed, if they don't want to be licensed, everybody stays together the whole time. Year 2, we move up that first class into the next level, which is really finalizing their license, registering them in QRS, teaching them about family engagement and program management, and we introduce them to a curriculum app that also leverages technology. And we recruit another class, and we take them through that initial process. And then in year 3, we move the first cohort into an online CDA, so by now they're really ready to do online training. And we move the second class to level 2, and we bring in a new class. And by this point, you essentially have created a pipeline that now stands, and your community is familiar and able to implement this. And we, at that point, step back. So your community is left with this knowledge, the resources, and the licenses for the training. So you don't have to recreate anything. So because we are a continuum, we do offer ongoing training for those women who are currently licensed and who just need more support. So we are hoping to launch an actual LMS in the very near future, which we are going to call Campus Luna. We have a partnership with Kinedu, which is a company that has a curriculum management platform that is available in Spanish, English, and Portuguese. And they are also partnering with us to develop technology training so that the women can access and use this platform. So we help them know how to use the platform. And we have an ongoing community that meets on a regular basis. We have every month, we have Café con Luna. And I just wanted to share with you that our last series of training, we offer a lot of very cutting edge, relevant, super high quality, visually beautiful training. And the last series that we're about to conclude this Saturday is a series on mental health. That was a 4-part series that talked about socio-emotional learning, self-management, self-care, that is completely directed at the provider for her mental health and her ultimately her being the center of the beginning of mental health is her own mental health. So that's my presentation. I would be excited to answer questions, or if you want to text me, send me messages. The next slide has all my contact information. So we would be delighted to talk to you more in detail if you want. Thank you so much.
Thank you, Pilar. Let's take a pause. You moved through a tremendous amount of information very quickly. So let's see if there's questions for you. We do have a few moments. It'd be great to see if folks have specific questions on the impact of Luna in communities and how they might be able to adopt. Kristen, go ahead. I thought you raised your hand. I was
how we're supposed to do it. I think it looks fantastic. I'm in Utah. And I'm wondering generally kind of cost. I know not detailed, but if you could give any kind of rough, order of magnitude of cost.
The cost really is going to depend on several factors, but I would say that the average cost is going to range between $80,000 to $120,000. And then the cost goes up a little bit because by the end of the third year, you essentially have 90 providers. So every year we're going to recruit between 30 and 40 providers. So the total cost for 3 years ranges between like $450 to $500. And then you would come out with in a perfect scenario, 90 licensed Latina providers. And depending on your local regs, times whatever slots, we always average it to about 5 slots, kind of being very conservative. Yeah.
There's another question, Pilar, in the chat on.
And I'm happy to send you, Kristen, like a detailed breakdown and also a breakdown of all the training that in detail and the supports that you would get year by year.
That would be fantastic, because if I talk to the state about it, they're always going to want to know a cost.
Yeah.
I'll put my email in the chat. Thank you.
Awesome. Okay.
It's a couple from the chat. The first one is whether Luna teaches business skills to the providers.
We have a couple of business classes, and one of the classes that we offered this year that was super hot was like how to apply for PPP loans. And we realized based on that they need a lot of support, setting up their banking account, their accounting. So we're really working on that. And we do have some training. Somebody asked me, I saw in the chat, is this available online? Everything is online. So we can do this from, long distance. We can do this across your state. So if you have several pockets of communities, or we can focus on one community. Yeah.
Pilar, the next kind of area of questions that came into the chat that I see somewhat related to each other start with this idea of establishing trust. There's also the idea of who does the recruitment and how do you find identify these educators in the community? How do you market for these types of opportunities and engage folks?
Well, the recruitment is like one of our secret sauces. So we work really closely with you to do recruitment in ways that are maybe a little bit out of the box for you. We bring new people to the table. We identify churches, we identify grocery stores, we identify, kind of informal community leaders. And in some communities, none of this is happening. In some communities, some of this is happening or a lot is happening. So we just kind of leverage whatever you have going on. And we basically support you and kind of just elevate everything a little bit, to go harder into the recruitment process. We also think it's really important to screen providers. We know that not everybody's ready for licensing. And so we work really hard to screen and figure out how ready they are and try to find the strongest group possible. And for this model, our ultimate goal is licensing, although we also know and believe that even if they don't become licensed, you have already elevated the quality of care for the FFN providers. So they're going to come out of this much stronger in terms of their knowledge base and their capability and their knowledge of children development and all that.
There's a question on whether the program utilizes shared services, and I imagine that you can speak to this one, Pilar, at least Maryland's experience, right? It's a complement to each other, right?
It's a complement. With Guinedo, we're working really hard to find ways to help the platform to grow it into a shared services model so that they can actually offer payment, billing, and things like that. They're not quite there yet, but we are working towards that. So there is a little bit of that kind of emerging shared services.
There's a few more. Let's see if we can move through there's about 4 more questions in the chat. I think some of them are probably quicker than others, but oh, I just lost where I was in the chat. Sorry. About handling documentation issues?
Kinedu can collect documentation. Oh, are you talking about like whether they're legal, the immigration status?
Immigration.
That's a really tough question, and that really has a lot to do with your local policies. We are working with other groups who are around the country who are looking at this. I can tell you that in some states, for example, I just found out that in Colorado, they were able to pass legislation where the providers didn't have to submit their social security number. And it depends on your state. And some states are like, don't ask, don't tell. Some states are much more kind of a little bit of a harder when it comes to that. But that is definitely a major issue. And unfortunately, it's really going to be more on you and your situation locally. But we help you work through that, and we give you a lot of ideas and support as to how we can develop. I think there's a kind of a national movement to really address this. I think it's going to be something that is a growing conversation, but clearly it's an issue, no doubt.
Then there's a couple questions related to specifications for participants. So do you have a specification about how long they have to participate? Do you have a requirement around whether the applicants have to be literate? And then the question on English and Spanish, I do want you to take that one, because I was sort of thinking maybe it's all in Spanish, but Beatrice has a question specifically on that.
So the question about that is, what do we do, bilingual or
yeah, is it in English and Spanish? I think
the training is to be honest with you, it's 100% in Spanish right now. Okay. We want to develop this in Spanish and English and other languages, and people who are familiar with this model have told us that it would be fairly easy to translate to other languages. As far as recruitment, we look at family composition, their housing situation, their immigration status, their level of education. We work across all levels of literacy. The training is, we've been told, is about a 9th grade level reading. And for some people, they have felt that it might be a little high. For us, kind of philosophically, we want to raise the bar a little bit for them. So we've never had any problems with anybody getting through it. But it can be a little challenging, but it's all very visual and very warm and fuzzy. So there's a lot of camaraderie and sisterhood, and there's a lot of kind of positive energy that helps them through the process. Well, I see somebody from Tennessee. We've been talking to Tennessee. We'd love to do something in Tennessee.
So there's a few more things in the chat that it may be great, Pilar, if you just like
keep answering.
If you want to follow up in the chat directly, and then if we have a few minutes left at the end, we can also come back for more questions. But I think that, and I know that since we're going to be sending out information after the fact, I think that'll help everybody out too.
Yeah, for those of you who want to receive more like cost breakdowns and all of that, just let me know through Danielle and Gina, and I'm happy to send you that. I think I might also just set up a session where we can have a deeper dive if you guys want to participate in that. So we can set that up.
Mm-hmm. Yeah. Thank you so much, Pilar, and thank you everyone for so much engagement and great questions.
I really appreciate all your questions. They're great. Thank you.
Continuing on our theme, we are going to next hear from Zhang Vang Li regarding the Hmong community and supports for the early childhood community Hmong providers. But before we do that, I do want to have us do one more quick poll as we continue to gather more information around your experience doing supports in multiple languages. Our next poll is actually around what languages you are offering the supports in. We're really trying to get an understanding of sort of the scale and scope and access to materials in other languages. Then you may, in looking at this list, this is actually the top 15 other provider languages that we find prevalent throughout the country. And so there may be some in here that you're even surprised to see that hit that top 15 list. I'll share my screen as before so that folks that may not be able to complete the poll can go ahead and.
That's a really awesome question.
And you should be able to pick more than one. So you shouldn't be limited to only one choice on this. So we're seeing lots of Spanish. Second, there is then Cantonese or Mandarin, Arabic, and then Russian.
This poll kind of illustrates a little bit about what I was saying, that even though we do have many languages represented, there is a big majority of Spanish speakers. That's not to say that these other communities aren't, they're growing fast. So we do need to be responsive to them too.
And it really also then the flip question would be sort of in these, maybe the languages you offer, do you know that you're meeting all the needs, right? There's that additional, there's always more data to understand whether or not are we covering the languages that we need to. And still a large percentage of folks noted that they don't provide supports in any other languages. So that's also a reality for many of the participants still. All right, continuing on, we want now, as I mentioned, we're going to hear from Zhang Vang Li regarding the Hmong Early Childhood Coalition. We're excited to think about going deep and really supporting another community and another language and how that's developed out in the local community. So I'm going to turn it over to Zhang.
Hi, everyone. My name is Zhang Vang Li, and I am part of the Hmong Early Childhood Coalition. I've been with the coalition for about 11 years. And I'm also a mother of 3. They were all very young when I, became or participated and became a member of Hmong Early Childhood Coalition. Prior to Hmong Early Childhood Coalition, when I started, it was our sole purpose, our main purpose was just to create awareness and identify key advocates to support early childhood education quality care for young Hmong children and families through an annual summit. And so we spent time planning, looking at data and providing information for planning those for the annual summit each year. In 2014, we restructured based on the feedback from our community. They were saying that, they're receiving all these great and wonderful information, the data and resources, like what next, and how do they follow up with us? How do we follow up with them? And so we decided to become a coalition so that we could expand our services. And just so you guys know, we are, can you go to the next slide? I'm sorry. We are a grassroots community-based organization just dedicated to sharing research and evidence-based practices on early learning. We partner with families and community to provide education and advocacy to optimize early learning for Hmong children.
Sorry, everyone. I might have been delayed there on sharing. So I'll leave it up for a second thing. Sorry. You might not have been seeing it.
That's okay. So this is who we are. Like I said, we are just all individual, community members, parents, organizations coming together to provide, resources and education for our families. Our mission is empowering Hmong families to seek opportunities to ensure Hmong children have access to quality care, quality childhood education. And then our vision is that for all Hmong families and children to succeed and thrive. As I mentioned, we've been doing this work all volunteer based. Many of our members are working full time, during the day and doing this on the side because we are all very passionate about the work and making sure that our families have what they need. And then I just wanted to say, along with that, we were able to receive a grant last year through the state to expand our work. So now we are, just this year, we've been doing a lot more, and we're able to do a lot more and provide more services for our Hmong children and families. These are our priority areas: translation and dissemination of information. So taking the information and policies that are out there and translating into more like simple language for our Hmong families, and then just sharing those sharing resources with families. Bridging families to services. So not just bridging families to services, but also connecting with providers, working with providers on how they can work with families. One of our partners had mentioned, how, we have such a huge population in the Twin Cities. How can we, engage with the Hmong community or get more Hmong families engaged in our programming? And so we're connecting families to services, but also providers to the families as well. And then the advocacy and systems change, just empowering our families to be their own advocate. As a mom, and an educator, it was really hard for me to know and understand the right language to ask for things that I need. And so one of the things is that, that we do is helping families to walk through and navigate the system, and just advocating for themselves, their families, and the community. With the grant that we received, our projects this year, which is aligned to our 3 priority areas as well, is the early childhood training sessions for professionals with follow-up and implementation. So, and then workshop or support groups, just creating a network for families, a space for families to come together, learn, and empower one another. And then outreach and resource sharing. We do a lot of outreach, being in the community, meeting with families one-on-one, out in events. We do some tabling, where we have a table of resources, connect with families around really everything. But what we do share is that early childhood education piece, along with early intervention services. We are connecting with friend, family, neighbor providers. We don't currently have a list here in Minnesota. I forgot to say that I am from Minnesota. I don't know if I did that already, but we have a huge Hmong population here in Minnesota. But we currently don't have a list of FFN providers. And so that is in the works. We've been connecting with FFN providers and have a running list of providers that we can connect with and provide resources to. And then, working with them to see if they are interested in becoming licensed as well. Writing and delivering professional development. We're developing courses based on the community needs, as well as, along the lines of, child development, social emotional supports, whatever the community, whatever we're currently needing right now. We've heard from our providers some of the things that they're interested in. And so taking what they're telling us and making sure that we, it's part of our plan and that we implement it in some way, shape or form with their support and voices in there. So I just want to focus on the early childhood training sessions that we've been doing for the purpose of this training. We've been providing culturally and linguistically, or providing trainings for early childhood educators that are culturally and linguistically appropriate. So topics that we have trained on are trauma, developmentally appropriate behavior, child development, health and safety, school readiness, observations and assessments, with, again, follow-up on implementation. We offer our time to be in their space and provide support if they need it. So we know that with our Hmong families, sometimes we're giving them a lot of information because the content oftentimes we're training for two hours, and there's a lot in the content in that training. And so we want to follow up with some support on how they might implement the skills that they learn or the strategies that they learned in the training sessions. So in terms of provider outreach and how we find our providers, we are very limited because we don't know where all our providers are. What we do know is that we've been able to find providers from the Parent Aware and our state website to identify the licensed and active early childhood educators, right? And so, and then along with, so on that list, we were able to, we found 47 Hmong providers. And we've connected with about 29 of them this year who have been attending our trainings. And then, we also catch them over at our outreach and outreach. So our events, community conversations that we have. We do a lot of social media posts so that people who are not, that we have not connected with, they are able to see the information that we're also sharing. And then a lot of times working with families, and especially in our Hmong community, it's all about relationship. And so, like, I don't just mail something, or I just don't post something, but if I do make that phone call, we do make phone calls to connect with these providers as well. And, when one of the successes this year is that we've had, a group of providers attending our trainings, but they're bringing in more people because of the word of mouth, right? Like they're interested and in the topic, but we also have a very engaging group of providers who just are able to share their experiences. And I want to go back in terms of early childhood, in terms of our trainings, we delivered in Hmong, and it's important that we do that because we understand, the providers, they understand, and not only that, but we're able to share and make those connections to their experiences. And so I know one of the responses from and feedback from our providers that we give the content, but that we are also given examples that relate to them, or that connects to their work. So they are very appreciative of that as well.
And can I jump in here? Because there was a few things you just mentioned that really relate to a question that was put in the chat. I think you're starting to tap in or to share some of these ideas of things that are really important cultural considerations in designing workshops for Hmong providers. Do you have any more that you may want to share? That was a question that came in.
In terms of designing workshops for Hmong providers?
Yeah, particularly those cultural considerations, like you mentioned, calling, linking the content, the child development content to their experience as a provider. Just anything else that the tips that you may want to share?
Other than, like just being, again, a lot of the things that we've been doing is just that building relationship with the providers, knowing, in terms of even gender, how to work and connect with, male and female providers. And then, sorry, and then just providing, one of the things that they did say, because space was so, we weren't able to get space this year. We didn't, things were closed until like about April. And we connected with our community, Hmong community organizations to ask if they can provide space when things opened up. And one thing that the providers have had said to us is that this is like our home, this is our community. And so having these trainings out in the community where they are familiar with is important to them. So yes, they say it's just like home. This is our home. So
thanks.
One of the things that we created this year are the learning kits, lending library for our providers. A lot of, and they're based on, the different developmental areas. And so, we're lending social emotional, we currently have the emotional learning kits because this is what our community needed this past year, to support our children and their families. And so we have books around social emotional, just activity, lots of sensory items that we put together and providers can borrow and use when they're doing a lesson. So this is just one of the many that we will have. And this is not just limited to our licensed providers, but is also open to our FFN providers as well as parents who are interested. And these are just feedback from our families. A lot of our feedback is that they love the trainings in Hmong, keeping everything in Hmong. I think every single feedback that we received after each training is, we want more training in Hmong. And we have monthly trainings, and we have one in December. We're focused on nutrition and health and nutrition. And so we'll be focusing on school readiness in January, getting ready for the next school year, because we know that a lot of our Hmong families are just families of color, don't always have access or know how to access resources or information around school readiness. And so, yes, our social media platforms, Hmong League Child, yeah, thank you. We have Facebook and Instagram. So please follow us on those. Are the workshops online or in person? Oh, yes. So we don't provide any online workshops or trainings right now. We're doing it all in person because that's what our providers need. What, we knew that most of our Hmong providers who only speak Hmong are not able to access the virtual platform. And so when we met our very first training in April, our providers were so just excited to see each other because it's been a year since they've seen each other. So there was a lot of networking and just sharing of this is what we need. Oh my gosh, thank you for having this, providing this opportunity. And so that's where we kind of learned of all the challenges and then the needs that they wanted. And they just threw topics at us, different trainings that they need in order to keep with their licensing. So yes. How do you identify FFN to collaborate and share resources with them? So a lot of our FFN, we connect with partner. We do connect with partner or different organizations because we know that that is important to continue and sustain our work because we can't do this all by ourselves. Just so you guys know, there's about five of us that are kind of running this work. And so we are huge on partnering with families and agencies to provide support for our families. And so we are getting information from, partner organizations are sharing it with their FFN providers. And then being out in the community and just talking to people, as well as social media. Those three have kind of been the biggest, ways that we've been able to connect with our providers, our FFN providers. In terms of trainings that we've done, there's 4 of us that are approved trainers through Develop. That's our state system in terms of our tool for our providers. And so 4 of us are approved trainers, and we train many of the state courses. And so around child development, we just finished with our family systems theory. We developmentally appropriate behavior. So many of the ones that I had mentioned earlier. And through who to get in terms of interpreting, I guess we do it all in Hmong. And one of the things that we did notice is that they have shared with us is that the documents are not translated, and because the courses are developed by the state or other organizations, we can't just take it and translate it and provide them with, or change it and provide it to our providers. And so a lot of it is just us sharing it verbally with them during the training. And then they get the English pieces. Are we looking to expand into other communities? We would love to. We know that it's important. And so we definitely want to. We're currently just serving the Twin Cities right now, all of Minnesota. But we would love to. Yes, we do know that there's a huge population in California. So Minnesota and California have the most Hmong population. Here in the Twin Cities, we have about 80, or in Minnesota is 81,000, and about 93% in the Twin Cities, Minneapolis, St. Paul.
Well, it sounds like there might be the opportunity for a connection there. I'm going to turn it over to Danielle to wrap us up. Thank you so much, Zhang, for this presentation and sharing your approach, as well as thank you to Pilar. As we mentioned, we're going to continue on with this discussion into the new year with more webinars and connections. So this is just the beginning of talking about supporting providers in other languages. So Danielle?
Before we go, we're going to leave the chat box open because we really want to hear what your biggest success in supporting home-based childcare educators who speak a different language, primarily speak a different language, has been. We'd love to capture those and invite you maybe to come back and tell us more on the upcoming webinars as well. And while that's open, and we invite you to put that in the chat, we do want to let you know that, as Gina's mentioned, we are going to have at least two additional sessions on this topic where we will look at other topics such as business supports. That was a question that came up today, workforce development and professional development. And so we hope you will join us. Those will be on January 18th and March 15th, and we will be changing the time a little bit in the new year. So please make a note if you've been attending regularly that we'll be switching to 3 o'clock Eastern, noon Pacific. So that'll give us a little bit more time, everyone, to have a cup of coffee before we come together. And before we go, we will put up the one last poll. We always want to know if these are meeting your needs and if it is beneficial to you. So if you would let us know if this meeting was useful in increasing your knowledge on the topic, we will hold that and take a look at that after the fact. And if there's anything that struck you as new, different, exciting, please put it in the chat box as well, and we will make sure to capture those. And we hope that you have a wonderful day. Thank you so much for joining us. We look forward to seeing you next time. Thank you to Zhang and to Pilar for sharing these exciting ideas with us.
I think a lot of you saw that I put the estimated cost proposal and training description for the 3-year pilot. So feel free to reach out to me if you have any questions. And I also wanted to thank Zhang for talking so clearly about belonging and trust, which I think are like really key elements to the work that we do with these special communities.
And if you didn't capture the docs from the chat, or if it's outside of your skill set to download a doc from the chat or follow the link, we're going to make sure you get those as part of the post-meeting materials and the recording, as well as the slide deck.
Yeah, and those will come in a few days. Anyone who registered will receive that email with those links. And please feel free to share them with anyone you believe would be interested. Thanks, everyone.